Hi, my name is Vol. By trade, I am a social worker and therapist who works with kiddos, but my main outlet and my passion is in powerlifting and just the human body. I am doing my best to actually gain my CPT license, so my certified personal training certificate and licensure through NASM, where that's in progress to combine with therapy. So I have reintroduced heavy weightlifting into my programming again for my body maintenance and my mental health. And it is a challenge because I am challenged with the fear of pain. And so, with that being said, I had a prior injury a year ago in my glutes between the piriformis and some of the funny little tiny obturators that did something. And we've been rehabbing that on and off. And so I feel confident enough where I am pushing my limits. And right now we're helping our glutes fire correctly and stop being a silly goose because they don't listen sometimes. But this week they listened. I do have some upper body tenderness going on. I do have some neck stiffness that would be lovely to look at as well. And it probably was a contribution from the main concern.
What is your main reason for choosing massage therapy to address those issues?
Well, I think that the neuromuscular patterns that you help me recreate have been so helpful in my lifting patterns. I don't think I would be the same person or lifter if I didn't have someone to kind of help me guide my nervous system because I get stuck in my brain and I get stuck in my head. And you help pull me out of that in a way that other either health coaches or regular therapists, like they can only do so much, but you actually have a feel on my body and can help guide me in the way I need to.
I love hearing that. And I love tracking the way that you remain aware over time of that interface between the somatic and like your body experiences and the impact on your mental health, that kind of anxiety and fear about pain level, and just continuing to choose bravery and challenging yourself to go above and beyond to take your body to the next level every time. And I know that when that's been like when you've had injuries where you had to slow down, that's hard on you. You've expressed like that holds you back in your like emotional well-being as well. And so I just always really appreciate your level of awareness of the interface between the body and mind and that work that we're doing together.
What kind of feedback are you getting on my left side, by the way? Because it feels interesting.
Yeah, on the left side, I'm definitely picking up what we call elevation, meaning that there's a bit of hypertension to the extent that it's actually taller on one side than the other side. And so these erector spinae muscles that are a fairly complex set of almost like contractile basketry from one vertebrae to the next has a cumulative effect of just being more bunched up. And so I'm kind of going through and helping mechanically lengthen the muscle fibers that have gotten a little more stuck in a contractile position.
That makes sense.
Yeah.
And it's funny because it switched sides. It's like the last I saw you 2 weeks ago, and it was not that side that was giving issue, or not issue, but it was elevated in that sense. So looking for practitioners, I'm always worried about like, can they handle somebody like me who I kind of know my body, so I'm going to talk about it, and I don't want to be treated in a way where like I don't know, or maybe they don't know, like what kind of practitioner are they going to get along with me, are they going to take my concerns seriously? It's something that's super common in any, honestly, specialty, especially touch-based medicine. You're worried, like, are they going to make fun of my pain? Are they going to tell me that what I'm experiencing isn't valid? Which has never been the experience here, but prior to that.
Yeah. Thank you for being super open with those doubts and fears. So it definitely is a gamble because it's a big investment of time and it's not cheap to get on the table.
But it is absolutely worth it when you find the right practitioner.
What was it that made you specifically say yes and just pull the trigger, book the appointment, do the thing?
Well, the first time I remember reading like about what you love to learn about. I think you had something about fibromyalgia and nerves
Oh
and that,
yeah.
and my brain was like, okay, she knows cool things about nerves and I want to learn things about my body. I think this will work. And so I just did it from there because I was like, I'm gonna have a comp soon. I need to learn about this feedback. I don't understand what's happening.
Mm-hmm.
And from there, and then when I started seeing you regularly, I was like, oh my God, I'm learning more about stuff every day, or every time that I come with you. And you know, create, instead of making it a one session thing, you created a dialect. And that I think has been so beneficial to my overall health.
Thank you. I really appreciate hearing you say that.
Thank you for having the conversations with me, even though I
Yeah.
don't have the right words. And sometimes I just call my hips ridiculous, whatever I'm feeling that day, whether they're silly gooses or they're just, I'm mad at them and I tell them and I don't want to talk to them.
I think we've talked about before that idea of like being able to have those conversations directly with the body, and that experience of like allowing ourselves to engage with the body. We have a little jump there. So that jump is just a automatic protective mechanism, almost like a reflex. It's kind of happening similarly to a reflex, but it's not like one of the built-in reflexes that has to be there. It's a little bit more specific to you. We've got a few more little kicks. See that?
Yeah, it's those little tiny pieces are mad about the internal rotation for some reason, because it's happening when you're rotating my hip inwards, right?
Let's replicate it again. So we've got a bit of firing just as I'm dropping, like that you're having that instinct to stop the foot from descending. But it was a little bit more firing on the lateral edge, meaning that, protecting that there. Medial rotation from getting folded. So, as suspected, as I'm jumping into where the movement was, there's some extra firmness. And this feels a little more strappy, a little more engaged. And it literally is the muscle tendon of the hamstrings as it's crossing the knee is locked into place a bit, because that hamstring is activated when it doesn't necessarily need to be quite so activated. And then because we found that place where it's harder, I'm going to kind of expect that there's somewhere a little softer. And so right where you were describing being able to feel it, we do have a little bit of like sunken or soggier tissue where the activation is weaker and kind of downplayed. So this is really common, that we'll have kind of too much structural force showing up in the muscle in one area, and then a corresponding place where it's actually a little weakened and a little tending towards reactivity or extra protectiveness. And it may also be an area where the circulation or the lymphatic flow is lower than average.
Mm-hmm. I think what matters too, though, is that you create a sense of safety for the person to access that discomfort and the sensation.
Thank you for saying that.
But it's so important, because if you didn't,
right,
then how would my body be able to respond in a way that isn't, what your goal is? Like it's hard to. Like, for me to even be able to talk through being flossed right now and reactivating those muscles is a huge testament to the connection that you've created and that sense of safety that you've created for my body to allow that to even happen.
Research keeps coming out really fast, and I'm seeing a ton of coaches arrive on the scene and like people trying to like bring in different strategies to approach this idea of the difference in movement patterns of neurodiverse people. And we're just starting to get this picture, and it's not coming in very clear yet on the societal level or on the medical system level. But with your experience in your clinical setting, what would be your just like top line observations with like the kids that you're working with? Can you see neurodiversity in like the way that they hold their elbows and the way that they walk and stuff?
Honestly, kind of, yeah. Because
Right?
for one thing, I think that is clear is that neurodivergence equates to a lot more need for sensation and movement. Whether the type of neurodivergence is irrelevant, it'll give you the specificity of what kind of movement may work better or like worse, or what kind of stimulation they need.
Right.
But like basically, neurodivergence equals need sensation, need stimulus in a way to make the brain a little bit happier, because they're either overstimulated with certain kinds of stimuli or understimulated with, the world. And so you can see it in movement patterns. My ADHD kiddos, oh my God. You can tell by the way that they tap their toe in like half a millisecond. I'm like, oh, here we go.
It's like so like stereotypical, right?
Yeah.
Like that, like, we as like in an education setting, right? We hope that people will not be slapping labels on unnecessarily or unhelpfully or like causing shame or whatever, but also like kids that are fidgety AF, you like, how much assessment do they need?
They don't. Literally, no, they don't. It's like
you can just see it.
Yeah, and you learn the diagnostic flavor, right? Like you learn the clinical landscape, you learn what it feels like, what that person is, but like, and that's so like intangible. It's really hard to describe until you're in work and like, oh yeah, I can spot a little ADHD.
Now, are you a diagnostician?
I can do, okay, so the thing with is right now my qualifications, yes, I'm trained in assessment, but I cannot legally like diagnose just yet without my license. Like it has to be approved by a supervisor. So yes, I can write a clinical diagnosis, but somebody has to approve it.
Gotcha. And then once your license comes in, which you're like in the final,
then insurance will accept my diagnosis from my name, not just somebody writing off on it.
I need a stack of your cards.
I know, I'm working on it.
Yeah, totally. I mean, I am not a diagnostician, obviously, and I
don't like that you say that though, because you have diagnosed sensation and problems and things like that. Now, whether it's qualified under our little thing of insurance and the medical system, that's another thing.
Yeah. And I would distinguish, like, I can certainly describe a lot.
Yes, your observation
I'm not the
skills
one that gives
are great.
the label of like, here's the name of your condition and you are autistic or you have ADHD or whatever, like that. That's not my scope of practice. And so that's why I say I'm not a diagnostician, but obviously I do like have a fair amount of clinical instinct, and I've been specializing in the nervous system and neurodiversity for like 6 years now or something, so it's like, I definitely feel like it's important for me to be there for people who especially haven't had that exploration opened up for them, that, like, I would never tell somebody like, you have ADHD, but I can absolutely be the first person who's like, you know what? I have ADHD. And I feel like we have things in common. Like that's part of what's helping me decode some of this stuff that's going on a somatic level in your body, and also like helps me predict some of the socioeconomic impacts that may be happening in your life, or some of the psychological, and so like that integration of like a wide range of practitioners. And I would say like historically massage therapy has been like pretty fringy, like we can bill insurance now, kind of. It's an absolute ass pain, I have to tell you. It's
oh god, I can imagine.
Like the probability of having to make up some like silly extra reason to decline any little thing is just like, it's rough, but there is a gradual increased acceptance of touch-based therapy. And as of right now, massage therapy really is the license for people who want to do like this kind of like this work in terms of a full session that is contact with
The body. Yeah.
right? That like even a PT might do a fair amount of massage. Lots of different nurses or like osteopaths like incorporate some massage in what they're doing, but that they're creating a different kind of experience overall, and they're addressing tissue in a different way. And but that as like the one person in my client's care team, that they're gonna like hang out for an hour
Exactly.
and be
and
like talk through
super intimate.
life.
Yeah.
And yeah, exactly. Describe their sensations, describe their, you know, lots of times I'm going over something and like all that Bessel van der Kolk stuff, you know, where it's like,
oh my
there's
God, yes.
specific trauma in a range of motion of this person's elbow or whatever. And like, I'm not trying to do some kind of clinical interview and be like, tell me what your mom did wrong, you know?
See, but
you know what I mean?
But that's what I want to do. Like, that's where I'm like, I'm seeing it.
But I'll be like going over that elbow and I'll feel something that's like, ooh, this is the sensation of a little kid that got yanked on from above.
Oh,
and
yeah.
it just got locked in there forever. And they'll start telling me some weird story about their mom. Like they'll just automatically go there, you know? And like, that's pretty normal for me.
Yeah, because our bodies keep the score. And even though that electrical pattern is there too, I think the neuromuscular data holds on to the transmitters over there and it gets stuck in that little pattern, just in the same way that we have the patterns of thought in our different brain structures.
So go ahead and take your time, have some deep breaths. And maybe I will come back in with you. Usually I have my clients meet me right outside the treatment room, but you can just pop the door open when you're ready for me to come back in this time. How's that sound?
Sounds perfect.
Okay. All right. Any reflections for me? What do we do? What do we accomplish today?
We definitely accomplished something because my hips feel entirely different than they did when I was sitting. But it's interesting talking during the session the entire time consciously.
Mm-hmm.
It
makes it different.
It makes it different. It's almost like the sensation rises because as you're working on and releasing downward, I felt upwards, like my jaw tensing because maybe I was thinking too much, or I don't know.
Definitely stay in that like cognitive engagement. Makes for a really different experience.
It's not a bad experience. It's amazing, but just something to be mindful of.
Definitely. I would not want anybody to be dependent on video sessions for their entire well-being, because it definitely is a different effect. And of course, for me too, it's like splitting my consciousness to calculate what we're doing in the body while also like having these esoteric conversations.
Yeah, trying to like put forth and beyond. Oh, there she goes. There's the bird. But putting energy into it beyond like because it's obvious that like your thought process isn't going into the movements, but what's happening, I think we'll just hold the bird. But what it's like that it's unconsciously happening what you're thinking about. So for you to put the energy to think about it and put it in a way that's actually like understandable for other humans to even listen in on. Yeah. It just takes a little extra.
Yeah. I think of also other sessions where we like much more go for that like deep state consciousness where we're like specifically activating theta brain waves and trying to capture that other sensation, like
because that's when my brain goes to an entirely different plane. And
exactly.
I back to my body like, oh, she did amazing things.
Yeah, and for me, I think part of that is this is a little speculative because again, we don't have like the Western science data points,
right.
But I tend to think that it depends on the like mirror neuron system, and that as I use my like history of my meditative practice and all of my like awareness of the theta waves in myself, then I'm trying to like bounce that into my client's body, and then like I get, whether that's exactly the mechanism or not, there are noticeable moments of like your consciousness
Being in
dropping
tune,
to match
to match what
as
you're
I
doing.
put a trigger of consciousness dropping. We're on this mission to just spread the news of how much touch-based therapy could help us fill the gap in what's missing in the medical system, especially for people in chronic pain who are getting handed opioid prescriptions like fucking candy, and it has to stop. And we are trying to just expand our tool set and allow for consciousness-based medicine, somatic therapies, touch-based therapies to find their space in the bigger picture. I'm a body worker. I'm a massage therapist. This is what I have to bring to the planet. So
and we
thanks.
want the planet to be better for humans.
Yeah.
That's all we want.
That's all we want.